Welcome to the community briefing. My name is Gregory Sneed, and one of the co-hosts here at the community briefing show. And today is the 5th of December, 2024. Only 20 days left until the big holiday, big Christmas holiday coming up. And if you haven't done your shopping, you just got about 3 weeks to make it happen and take care of business. So, excuse me. So thank you for joining us. And we have a special guest today, Tom Mueller, and he'll be talking to us about what's going on in the healthcare industry, in particular, the dialysis. So stay tuned. I'm sure we all have friends and family that are experiencing some of the issues that he's going to be talking about. So take some notes and stay tuned. It's my pleasure now to welcome to the virtual stage Miss Crystal Mitchell, the queen of the community briefing.
Good morning, everyone. Hope you guys have all had a wonderful Thanksgiving. Didn't eat too much, or at least exercised it off afterwards. It was restful for me, so I'm glad to be here. If the holiday season is here, I don't even think I can manage my own calendar. I can't even exercise because there's just too many things on the calendar. Some I can make, some of them I can't. But we are thrilled to be here. We got 2 weeks. We're going to have this week and the next 2 weeks, and then we're going to go dark for the holidays. And we will be back at the first of the year with some amazing guests. We got a great lineup to end out the year, so we're excited about that. So I am Crystal Mitchell. I'm the co-director of Recycling Black Dollars, as well as the inspiration behind the community briefing. This is our platform for us to network and meet people who are sitting at tables making things happen, and just to be informed so that we're not sitting in the dark without information. So we've been very blessed with some incredible guests that have been bringing some information. So I hope you guys that are here are benefiting from it. And please make sure you go out and tell everyone about us. We are sponsored and powered by Recycling Black Dollars and the BBA. And we're monetarily sponsored by Los Angeles LDC, Southern California Edison, Wells Fargo Bank, PCR, and SoCal Gas. And if you want to support us, we are here with open arms and many thank yous and hugs. We have a fantastic hands. We have a fantastic team here. We have Mr. Gregory Sneed. He already introduced himself. Ms. Robin Billups, and Mr. Stephen Turner, who is our producer, and I make sure all the guests get here safe and sound virtually, and we thank him so much for that. And we have our guests that come in weekly, and we thank you for the support. And with that, I am going to kick it over to Ms. Robin.
Good day, everybody. Happy December. Here we are in the 12th month. The year went by kind of fast. Say, as a kid growing up, your mom, in the Bible, it always talks about, entertaining strangers. And so our guest today, I met at the State of Black LA hosted by the Urban League a couple of months or so ago. And so, you don't know who's going to come into your life, and you don't know how they're going to impact your life. And I'm looking forward to the presentation today, because this is a person who's committed their life to fighting fraud. And so, but what I will say too is tomorrow, the Crenshaw Chamber of Commerce is hosting a community forum in relations to the project that I'm working on with Michael Anderson. I'll drop that in the chat box, but it is going to be on Zoom. And basically what we're asking for, we have federal support, we have state support, now we need to get local support to get this money to improve our infrastructure, the transit and ownership, retain ownership housing around the 24 transit stations in LA County. Again, the whole mission of community briefing is to inform, to enlighten, and to give us some tools that we can work with once we unplug from each week when we're online. So I'm going to turn it over to Greg so we can actually get started. But thanks again for your support, and thank you again for all of our regulars who, we try not to call your name every week, but you know who you are because you're here every week. Thank you.
All right, just bear with me a minute here. I got some activity going on downstairs, and the dog is going crazy. So just texting my wife to see if it's an emergency. Oh, okay, we're good. All right, good, fantastic. All right, so our guest today is Tom Mueller, and he has a very interesting and depth background. So I will share that with you. He is a senior fellow. I'm a gregarious fellow, but he's a senior fellow at the New School Center for Race, Power, and Political Economy Project. And he works there with a team of medical scholars and economists, drawing a detailed picture of the impacts of big dialysis on the disadvantaged neighborhoods and identifying ways to improve kidney health and dialysis care in the communities. He's also a freelance writer of nonfiction and fiction, and he has studied at Oxford, and he is a Rhodes Scholar. I was a Rhodes Scholar too, but I was driving to go to college, so I was on the road. Kind of different, right? It's a different Rhodes Scholar, right? So I just made that up. I don't know where that's come from. And also at Harvard, Harvard with a BA summa cum laude, and has worked as an associate in mergers and acquisitions at Goldman Sachs in their London and Frankfurt offices, and studied classical guitar. Man, you got a lot of stuff there. Classical guitar in Sevilla, Spain, and with America Martinez, a disciple of Andres Segovia. So he has a book, How to Make a Killing, and it's a look at the shocking world of the U.S. healthcare through the lens of the dialysis industry, where a miracle cure has become a nightmare for many patients. So I could go on because he's done a lot of stuff, but we're going to quickly bring him to the virtual stage. So please join me in welcoming Tom Mueller.
Hey, thank you very, very much, Greg and Crystal and Stephen and Joseph and Robin Billups in particular for bringing me into this conversation. It's really, really exciting to be here. And all the stuff that you mentioned, including the driving scholarship, is kind of a I think a preparation for what I'm doing now. At least it feels that way to me. What I'm going to aim to do today is talk about dialysis and kidney health in America, what's going on, what's going wrong, why it's going wrong, what everyone needs to know to protect yourselves, and what we better do about it to make it better, to fix it. So, and I'll, aim to show also how some of the problems and the dysfunctions and the cruelties and the structural harms that are going on in dialysis also reflect the broader healthcare landscape. Dialysis is kind of the poster child for what can go wrong when you follow profits over patient care. And if you want better healthcare, fixing dialysis will give us a lot of tools and knowledge we need to do that. And we certainly need to do that. The situation we're in America right now is just not sustainable. So very quick legal disclaimer, which I need to say because I took on some of the big dialysis companies in my book, How to Make a Killing. And unfortunately, that title is absolutely accurate, as we'll get into. But before publication, I sent the text of most of my all of my hard-hitting statements to these companies. Some of them responded, some of them didn't. I included their responses, and basically they said I was full of it. But I stand by my reporting. I stand by my years of research, my hundreds of interviews. If you look at this book, it has 60 pages of footnotes. Mm-hmm. I know that what I wrote is correct. So I encourage readers or listeners to have a look at the book and draw your own conclusions. But this is what I'm basing on. So I started off knowing nothing about kidneys or about dialysis. People talk about brains and heart and guts but they never talk about your kidneys. And these kidneys, right, are these little organs hidden away in the back, behind this, around the spine, not in the main area where the organs are. And who knows what they're for? Well, they are actually like the conductor of a great symphony of the human body. They regulate and maintain homeostasis, this sort of steady state that all the other organs require for life. So they're magical. The problem is when they break down, the whole body goes into tilt and it breaks down in so many different ways. So kidney disease and kidney failure is a huge, huge problem. We'll get into that. I started off, again, not knowing anything about dialysis. I started, while I was writing a book on whistleblowing, I started talking with a few whistleblowers from the dialysis industry. I'm like, what's that? And what they had to tell me, they were executives that had found wrongdoing in their companies and reported it. Um, and they were saying, hey, look, these companies are putting profits before patient health and well-being in a massive way. I'm like, wow, that's okay. So let's look into this more closely. I started talking with nephrologists or kidney doctors. Started talking with registered nurses who are the front line and dialysis techs and dialysis executives of various kinds. But really, when I started talking to patients, that's when the whole thing started to break open for me. And here, in a nutshell, is what I found. The fact is that kidney disease is a silent national emergency. In fact, the American Medical Association just July this year proclaimed kidney disease and dialysis a national emergency, and they're absolutely right. Chronic kidney disease affects 37 million Americans, so 15% of the adult population, and it is growing at an alarming rate, and only 10% of the 37 million even know they have a problem. And unmanaged chronic kidney disease can end in end-stage renal disease. In other words, kidney failure. Your kidneys fail. And you, at that point, in order to live, you need either a transplant, which is hard to do, hard to get, and the organs are limited, or you need dialysis. Otherwise, you die. There is no third option. And today, more than 800,000 Americans live with kidney failure, double the number of patients of 20 years ago. So, the growth in this industry is huge. And over 500,000 of those people or those patients are on dialysis to stay alive. So in America, which is, you keep hearing, well, the greatest country the universe has ever known and so on, we do really, really badly in dialysis. Dialysis in our country is a travesty. Our patients suffer more cardiac arrest, more infections, more death on dialysis than the rest of the developed world. I mean, for instance, in patient mortality, people dying on dialysis, we're absolutely the bottom of the pile. We're the worst developed country, and we're worse than some lesser developed countries. Dialysis patients in America die 2 to 3 times sooner, and that's rivaling mortality rates of stage 4 cancer. That is not the case in other countries. So, at least from the point of view of dialysis, but also I would argue in the healthcare sphere, we are not the greatest country in the world, and we have a lot of work to do. So basically, short, high-speed, high-pressure dialysis, which is delivered by the big 2 companies that control the market, is harmful in itself. It's not the right way to do dialysis, okay? And it causes these bad outcomes, heart failure and so on, but it also causes bad symptoms, cramps, nausea, sudden drops in blood pressure, dialysis fog. One patient described it as having the flu every day of your life. Which really kind of brings it home, right? This is not a good thing. And in fact, the quality of life of our dialysis patients, as opposed to dialysis patients in other countries, can be is worse by many standards than people who have cancer, who have cystic fibrosis, who have chronic asthma, sickle cell disease. Dialysis is a huge physical and mental load in America. And how much are we paying for this terrible service? Well, guess what? We're overpaying. We're paying way more than any other developed country. About $100 billion a year goes into this terrible care. So not only is it not good care, we're being ripped off, right? $34 billion alone, it is spent by Medicare. So that's 7% of the Medicare budget to take care of 1% of the patients. And this is, again, only in America, only in America. So, and if it's a national emergency for Americans, it's in particular a national emergency for Black Americans. If you're Black, you have 4 times more likelihood of having kidney failure than if you're white. And that's partly due to some genetic factors. There's APOL1 alleles. If you have 2 of those, you're more likely to have kidney problems and so on. Some biological factors. But really, none of this sort of biological and genetics explains the disparity, the level of disparity. 4 times more, right? This doesn't explain it. I'll tell you what does explain this. Well, medical researchers and social scientists have this kind of fancy term, social determinants of health, but I prefer a plainer, less highfalutin language. I think the word is racism we need here. What causes disparity in dialysis and in so many other medical fields, not just dialysis? I mean, the list goes on, is decades of social and economic injustice, rooted in racist housing laws, redlining, segregation of communities of color, separate and unequal education systems, environmental racism, a distorted criminal justice system, and a distorted education system, and the list goes on and on and on. That's the real cause of this situation. And food deserts and healthcare deserts, which are linked to each other. Robin was mentioning this at the beginning of the program. These people who live in food and also, which are often also healthcare deserts, they don't have access to healthcare, they're almost guaranteed to have problems. Um, these are the neighborhoods where you see dialysis clinics on every street corner, where patients I've interviewed have to decide between having a meal or buying a tank of gas to get to the clinic. And I know a lot of patients, and I have known a lot of patients, um, because a lot of them have passed on since I wrote this book, I'm sad to say. People in America don't last very long on dialysis, and that is a shame. One of the heroes, my hero, personal heroes, one of my inspirations for writing this book, and one of my continuing, sources of inspiration is a man named Magellan Hanford from LA. Well, actually, he's originally from Alabama, but he moved out to LA, became an LAPD officer. And then when he became a single father, he retrained as a dialysis nurse. He figured it's going to be easier than fighting the street gangs in the barrios of East LA. Well, guess what? He says it was more brutal, more difficult. And he talks about the kinds of neighborhoods where dialysis is prevalent. And this is a quote from my book, from Magellan Hanford. Today in our neighborhoods, there's a McDonald's on one corner, a Jack in the Box, and a Burger King on the others. That's what people of color eat, so no wonder they end up on dialysis. This is a system, a cycle, a trap for many people of color. The whole thing has Jim Crow written all over it, and I couldn't agree more. And we'll hear more from Magellan Hanford in a bit. So what is going on in these clinics? What happens to you, your loved ones, when you go on dialysis? Quite often, people are not given proper information about transplantation. They don't tell you, hey, by the way, you got to have a transplant as soon as possible to get off of dialysis. Why would they not do that? Well, because it cuts into the cash flow. Every person who has a transplant leaves dialysis. Do the managers want that? Nope. No, they don't. They don't tell you about the different kinds of different modalities, the different styles of dialysis you can do. You can do dialysis at home. You can do dialysis, peritoneal dialysis, which is a different kind of dialysis. No, they tell you their business model. They say, sit in that chair and we'll hook you up. And once you sit in that chair and you get hooked up, after a certain period of time, you may have a little residual kidney function. That goes away. That goes away. You don't get personalized care in these places quite often. Again, I am generalizing. There are clinics that do it right, that have the best possible people. Magellan Hanford was an example, who take very good care of their patients. And I want to say that the Magellan Hanfords of this world, the good healthcare workers out there, they too are victims of this system, because they're being forced into this assembly line style work, which forces them to give their patients improper care, and they're mortified by that. They're morally challenged by that. So, I've run into a number of cases of involuntary discharge from dialysis. People raise their hands. A nurse, a former nurse in Atlanta, Georgia, a registered nurse, so she knows a bit about sterile procedure, saw a dialysis tech, an unexperienced dialysis tech, taking the needles, about to hook her up, and she didn't wash her hands. My friend, this nurse said, hey, "Excuse me, could you wash your hands before you stick those 15 gauge needles into my arm?" Boom! Immediately, she was the person who was troublesome, the disruptive patient, and she was marched towards the door. It's just unbelievable. And many cases of that, many false accusations of violence or threats of violence to get people out the door, when, guess what? They're not profitable anymore. These are only people who are on public insurance, so Medicare, Medicaid, not privately insured, which are much more lucrative. And strange to say, those people don't get terminated. And there are even reports from dialysis experts, from nephrologists, that I'm getting, of people being systematically put on dialysis before they even need it. Okay. 3 separate nephrologists from 3 separate major metropolitan areas in Northeast have told me that this is called the dialysis hustle. They even have a term for it. And they target people, usually young Black males, who last longer, and put them on dialysis before they actually medically need it. It sounds more like ranching than it does healthcare to me. I don't know about you folks. Again, this is an exception, probably, I hope. There are many places that do it right, but this is shocking and this is real. And it took me a long time to really believe this. So Magellan Hanford, again, he's describing the way in which he's worked off his feet. He has to take care of up to 17 people at a time in the clinics in Los Angeles where he worked. And he describes the cramping, the fainting, the coding, the bleeding out that these patients are doing. 17 people popping around. You can't give people a high level of care in a very, I mean, it's emergency room care done in the strip mall. This is serious stuff. You're hooking people major arteries with huge needles. If stuff goes wrong, it goes very wrong, right? And so here's Hanford describing the atmosphere in these clinics. I have to move fast from one patient to another. No time to ask them how they feel, how their family is. Just, okay, you're still breathing, and move on. My job is nursing people, but I can't do my job on this assembly line. More than once, he says, he and his coworkers had to leave the lifeless body of a patient in the dialysis chair, concealed behind a screen, while continuing to treat other patients. All the companies are concerned to do is dialyze. Those are the words of Magellan Hanford, and he would know. So it makes this workplace sound more like a field hospital in a war zone, not a proper healthcare clinic. And again, many of these workers, many of whom are Black and brown, are also suffering. They're being forced. Magellan said, in the LAPD, we used to say, to protect and to serve. And we tried to do that. Well, now I can't. I have to do that for my patients, but I can't. So why is this happening in American dialysis? Very straightforward answer. Because the industry has totally been controlled by massive public corporations that put profits over patients and care more about shareholder value than their own patients. And don't just take my word for it, take the word of distinguished economists. There's an economist at University of Chicago called Thomas Woolman. He wrote the famous paper, How to Get Away with Merger. And it's about the dialysis industry. It tells about how stealth consolidation, how these two big corporations just played Pac-Man with the whole industry over the last 25 years and gobbled up all the competitors until they control 80% of the market. Other economists, Ryan McDevitt at Duke Business School, has described what happens when these great big conglomerates buy up private dialysis practices. And I'm quoting Ryan McDevitt here. They start implementing their best practices, at least from their point of view, which means maximizing profits. So they're pumping patients full of drugs. They're cutting back on staffing ratios. All the things that make a business really profitable and productive, they're doing. Unfortunately, we find that this has severe consequences for patients. Death rates go up, hospitalization rates go up, transplant rates fall, and so on. Any measure that could get worse probably pretty much got worse after the big chains acquired independent facilities. So these bad things are happening because of huge corporate power and relatedly next to no real regulation. I mean, the regulators are either asleep at the switch or they're captured and revolving door with the big dialysis companies. And these dialysis companies have massive rap sheets for Medicare fraud, illegal kickbacks, wrongful death, drug wastage, improper billing, Foreign Corrupt Practices Act, if that wasn't enough, unnecessary medical surgery, surgical procedures, and so on. Almost invariably settled with the stroke of a pen, writing a great big fat check to the government and moving on their merry way. Nothing has changed. And the reason these things are continuing to happen, apart from corporate power, is ignorance, I think. Our ignorance. My ignorance when I started this, we simply don't know what's going on behind those beautiful pastel storefronts, right? That you drive by and you're like, oh, doesn't that look nice? It looks sort of like Disney World. It isn't Disney World. It is not Disney World here. I was ignorant. Now I see. You may already know some of this stuff or a lot of it or all of it. But if not today, I hope this will be a wake-up call. So bigger picture, dialysis is a microcosm, as I said, of American healthcare. We are getting worse care in America for more dollars than anywhere else on the planet. So if we want to say that we are the number one, we're the number one in that. We're the number one in getting ripped off in healthcare. I mean, that is not something to be proud of, but it's the truth. At least that's the truth.
Tom, question.
Yeah, by all means, far away.
Certainly we have people who are listening who have this experience, and I've actually been in a dialysis center when I was looking for my cousin and I thought he was home. He wasn't home, and his neighbor told me that he was at the dialysis center. And I go in there and it's just like it's like going into a nail shop. You got all these chairs lined up, all these people lined up in these chairs, all of them are hooked up to something. And he ended up having, we were exactly the same age. He ended up having his right leg amputated, the left foot amputated. Then he passed away. He passed away last year, 68 years old.
I'm sorry,
But
Rob.
wasn't a smoker, didn't live a bad, didn't live a halfway decent life. But, to your point, help us understand what can we do to help? How do we move this forward? Who do we need to contact? Who do we need to be pressing on because we're at the point now where we know the challenges, we know the problems. We appreciate the fact that you've given us some statistical information. This book, the type is very small, guys. The type is very small because it's a lot of information. But give us a couple of 2 or 3 things that we can do in support of what you're doing and in support of our community.
Yeah, no, absolutely. And that book goes one page at a time, so that's good news. You don't have to eat it all at once. But truly, it's good question. We need answers. We need to ask questions to get those answers. We need to learn what's going on. So, Robin, you learned when you're looking for your cousin what it's like to be inside a facility. And by the way, they don't always let you in, right? There are these security cameras and a lot of questions. Not always easy to get in. So I would say, what are the things that I would say to do? First of all, find out what's going on in your local clinic. What's happening to your loved ones, your cousin, your mother, whoever it is, or to you. Don't take the first diagnosis. Do I really need dialysis in the first place? That's a question that you need to push on, and you need to get a second opinion. You need to get someone who isn't seeing dollar signs when they're looking in your face, right? And figure out what your options are. If you do need dialysis, there are different kinds of dialysis. Can you be doing it at home instead of in center? Can you be doing peritoneal dialysis instead of hemodialysis? These are questions that they by law are required to tell you, but that they are not. Okay. Also, what are your options in terms of insurance? They will push you towards COBRA, towards a private insurance, towards the American Kidney Fund, waiver program, and all these other things. But that's not always good advice. That's not always good advice. And I think importantly, too, involve people who aren't part of the medical industrial complex to get a second opinion. Get your preachers and your faith communities educated on this. Get them mobilized. Get them angry about what's going on. Get your local, state, and national representatives involved in this issue. Congresswoman Maxine Waters, who was in the state of Black LA and spoke, I don't think I've ever gotten bigger goosebumps than listening to Maxine Waters speak at the state of Black LA in October. That was, and she knows this industry very well. She's written some really tough stuff. She's asked some very good questions. Get folks like that to say, 37 million Americans, many of whom Black and brown, we need to do something right now. The American Medical Association says this is an emergency. So what are we doing about this emergency? And I had to say, I think there is some good stuff happening too. I've been doom and gloom, and I know this is, not exactly dinner time conversation or happy, but the bad news is somehow almost the good news. Things have gotten so bad that I am getting a lot of allies, people that I wouldn't have expected from across the political divide, across the political spectrum. Things are just so, I've gotten more than 2,000 emails, messages, and so on and so on. The book came out, a lot of new information is coming in. The FTC is looking at monopoly power. There have been hearings in the House Ways and Means Committee, Congress, and, it's all worked up about private equity. Well, this is an example of private equity rolling up and consolidating and squeezing every dollar out of medicine. And I'm working with the Robert Wood Johnson Foundation, who's supporting some work on dialysis. The first Trump administration, okay, let's just put it out here. The first Trump administration produced, with Alex Azar, the head of Health and Human Services, the best policy document for dialysis in the last half century. No question. If we could execute that document, it's called the Advancing American Kidney Care Executive Order 2019. We could execute what it says, we would be in a much better place. So maybe today, Trump 2 is happening, and that's just the way it is. Maybe we're going to get CMS and FDA to act, and others to actually execute what that executive order tells us to do.
So now with that person that he had in charge of health and health, that I forgot which one it is, but the person
Alex Azar.
Yeah, Alex had a background. I'm getting concerned
did.
that the persons that he's pushing, most of these people don't have the background in this area that we're talking about. So with the change of administration, hopefully the existing staff stays, and there's some legacy folks that are there. But I want you to, when you get a moment, send us that information, because we can, what we're trying to do going into 2025 is to collect up these resources and have this information available so that because we're wanting to become more politically active, not just when it's a big election, not just when it's a mayor or a president. We want people to understand that your advocacy has to take place every day. And so, Tom, what you've shared is exactly what the community briefing is all about. How do we advocate for something like this, especially when this is a major killer in our community?
Absolutely, Robin. And I think community briefing, that word community is the key here. That we can talk about the national policy and we can talk about state regulations, but what we really need to do is get up off our couch and walk outdoors and say, where's the nearest dialysis facility? Let me just scope this place out. Who do I know that's getting treatment here? How good is it? Where is it on the 5-star rating system, which is online? Check it out. Check out, the message boards where people say, is this good? Is this not so good? Start asking questions. Start asking questions to the people that come out. How's care here? If everyone in America did that, it would be a way, way, way better. First of all, it'd be a wake-up call to the industry. We better do better because wow, these people are really not happy here. They know our game now, right? I mean, I don't want to be simplistic, but it is
that simple.
We're being played. All right. This is not good enough, and we are being played. So
to your point, it is that simple. Advocacy is just that simple. Everybody has something that's affecting them, and it's affecting not just you, it's affecting a community. So if we just do the simple thing of, like you said, raise your hands, ask questions, and use social media for advocacy, not just for gossip, right? Not just for checking out somebody else's stuff. What are you doing about your own stuff? So that's wonderful. That's great. Do we have any? We don't have any questions in the chat box, so I'm opening up for people to put their questions in the chat box because if you have comments and or questions, or we got a subject matter expert here for one thing, but please put the questions in the chat box, or you can just raise your hand. But please, when you're asking questions, make sure it's not so personal that somebody else can't benefit from the response, right? Let's ask community questions.
And also, I want to say that if even after, or people listening to the recording, or anybody that you folks know wants to get more information, Robin the Connector can put you in touch with me at any time. She can find me anywhere on the planet and put you in touch with me. So I invite people seriously to reach out if they have questions, they want to know more. I'm kind of I'm becoming a sort of a switchboard. I guess that's an old-fashioned statement now. There are no more switchboards.
No, there's a real
a senior fellow is the color of hair, right? So I guess maybe that's what the senior thing is. But anyway, I see Cheryl has some senior too. But no, I'd be honored if people reached out. I can't promise that I'm not a medical authority. I want to say that, but I know some medical authorities, and I can at least give you the game plan, the rule book, and the playbook by which, in many cases, people are not getting the right kind of care.
Shamika had a question. Who do you notify when you see these terrible quick clinics, or where's the whistle that I can blow for my clients? I love that.
Very, very good question. Very good question. The obvious answer is the state health board, because technically speaking, they are responsible to on a regular basis, and it should be way, way more. They're underfunded for a reason, and so they don't do these inspections, but they should be inspecting every healthcare facility, including a dialysis facility, on a regular basis. They also maintain a list of bad facilities, which I have tried to get, but they won't release it even under FOIA. So why not? Why aren't you telling us that you already know that there's a 10% of really terrible facilities and you won't release that information? I want Maxine Waters to help me to get that information out. But anyway, that's a side story. The question remains, who do you call? There's state authorities. There's also something called the ESRD networks. Once upon a time, and this is again my personal opinion based on 6 years of reporting, but once upon a time, they were a serious thing. They were subject matter experts in dialysis. They have since been sucked up into quality improvement organization, kind of a generic thing, and they're chosen on a low bid basis. And they basically, I tried to get some of these people on the phone, and I got maxed out voicemail. That's all I got. So the ESRD networks, depending on where you are, because there are certain places where it actually does work, and there are people who are good. And there are other places where you can't reach them, or they're revolving door people who are really on more, in my view, on the side of industry than the side of patients. So this is a long way of saying that question needs to be answered in a proper way. State and ESRD networks. But I think, I think we also have to keep an option open for legal action. And so far, I mentioned there are a lot of legal actions that have ended in settlements and done nothing. But, keeping the pressure on and looking at this as a civil rights issue and a human rights issue, and not just, malpractice. I think that's an important way forward.
Kim has a question. Hey, Kim.
Hey, family. Okay, so this is a twofer. The first thing that I've always been curious about who the investors are.
Mhm.
And I think at one time, Pepsi, of all people, were investors. I can't find them on their roster right now, but I know that BlackRock and Berkshire Hathaway, and they own a lot of fast food. So
Yes, ma'am.
it's like,
It's the highway, right? Yeah, you
right?
get on at Burger King and you get off at, yeah, exactly.
And the shareholders get paid on both ends.
Yeah.
So I think it would be advantageous to kind of follow the money trail as well, and let those other companies know that you were investing in our demise. And the other thing is, I remember doing a health fair, and I tried to get in touch with DaVita, thinking they would be happy to come out. And I basically got the
Short shrift.
the circular file. I don't know what to call it. And they legit did not care. They did not care. And I don't know if I've ever seen a DaVita advertisement. And so that leads me to my second point. Our newspapers need to report on a regular basis. What's up? Why do you say that, Joseph? I would think, okay, so I would think that it would be because we would be afraid of losing news revenue, but advertising revenue, but they don't advertise anyway.
It's true. Very true.
So which is even more arrogant.
Mhm.
So
Yeah. No, exactly. Two very good questions. I will answer that. Yeah, you said Berkshire Hathaway. I mean, Berkshire Hathaway and Warren Buffett own 40% of DaVita, which is one of the two giants. And I've been thinking about making T-shirts with this on them and getting a billboard at the next Berkshire Hathaway, annual shareholder meeting, and just say, hey, you know what you're investing in? Hey, have a look. Read my book. If you don't agree, that's fine, but read the footnotes. This is the real stuff. That's sort of like lighting a fire and seeing what happens. That may not be structural.
No, a T-shirt idea is a great idea because part of that is just education, right?
Yeah.
People, most of us have grown up that medical people, the police, the firefighter, these people were special folks, right?
Yep. Yeah.
Well, now people are starting to realize they're just everyday folks just like we are. That's just what they do for a living. So it's critically important now for us to vet everybody and everything. So a T-shirt is something that people would glom onto, and it's going to always trigger conversation, right?
Yeah.
And so again, I think that, as we put on our big girl bloomers and start really, 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 really looking at 2025 as the year of advocacy, stop it, Sarah. As we start to look at that, we're just raising our hands and say, help us understand, right? We're not trying to attack anybody. We just need you to help us understand what you're doing, why you're doing it, how you're doing it, who's paying for it, how much is it costing me? And I think that's the advocacy move that we really are pushing here on the community briefing for 2025.
Yeah, that's something I tell you. One of my proudest moments in my life was I got a photo of a patient with a mask reading this book, and the nurse looking at the title of the book, walking by and looking at the title of the book, How to Make a Killing, as they're sitting there. And I thought, oh, that's pretty. And then a week later, I got a call from a family in Houston, Texas, and they said, we read your book, and now we understand that this is a business model. It's not a one-off. It's not a bad inflow, not a bad clinic that we're in. And as a result, they were able to use the book, use the information in the book, and push the big company to treat their father better and to get on the transplant list. He was not even on the transplant list. He was put on the transplant list and got a transplant. As a result, I mean, it might have happened anyway, but they said, "Hey, thank you for opening our eyes. Now we have the tools to move forward." And that really was one of my proudest moments because this guy has a transplant now. He's not on dialysis anymore. And that's what we want here. I mean, the best way to take on the big people is to make them irrelevant. There are absolutely ways that transplantation can get better. The GLP-1 and SGLT2, the Wegovy and all that stuff, those are miraculous kidney care drugs. Miraculous. Because they work on the precursors, they work on diabetes and heart conditions, but they also are incredibly good for your kidneys. And if we could get those at low cost delivered to the people who need them, dialysis would wither up and blow away. It would no longer be. So you don't have to go, guns a-blazing at them. Just make them irrelevant. That's the best. We shouldn't have people with failing kidneys in America. I mean, very few. There are certain people who have genetic things that are just nothing to be done, but very, very few. And the rest can be prevented. And that's the way to take care of dialysis ultimately.
That's great. Cheryl, you look like you want to say something. Thank you for joining us today.
I'm sorry. Good morning, everyone. I'm over here furiously typing as we go. I'm like, this is one of those topics that for me, I started trying to be an advocate. I live in Inglewood, and I tried to be and develop a program as a reflexologist. I had gone to China, I had studied there, and I saw how they dealt with disease. And the same way we have nail shops, they have reflexology places, right? Where there's like chair, and people are sitting there. And we even went one evening to one place and it was like a cigar bar, but the guys were all there with their feet having reflexology at the cigar bar. It was crazy. But I mean, this was over 20 years ago. So coming back, I tried to get with some of the dialysis doctors and different entities and said, listen, let's just do a study to see how this would affect how having this touch, developing and working with better circulation, these things would help. I couldn't find one. But then I had people that were hearing me ask the questions, asking me if they could come to me. And so I started working on, and they were actually better. Circulation improved. They were lowering their insulin. And I'm telling this to the doctors and still nothing. And I understood. And it made me go and get my esthetician license. And I'm like you, I'm writing a book right now about the whole industry because if we don't understand the questions to ask and what you've brought up with all the different options as far as even dialysis, self-care is the word that we need to do and use going forward in our communities. We have to understand what that means as far as cancer, as far as diabetes, all these different diseases that I feel personally that we're past the awareness. We need prevention and cure.
Yeah, perfect. Thank you, Cheryl.
Thank
Put your information in the chat box.
Yes, ma'am.
You guys, I actually looked up Tom's information and put it in the chat box, and it really is. His website is amazing. So when you get a minute, take the time to look at his website and let's support what he's doing. Tom, we know that you're under attack. When you do this kind of work, you're gonna be under attack. Tell us a little bit about your background. Where'd you grow up, and all of that kind of good stuff, and how did you get into this fraud prevention, fight a good fight kind of guy?
Well, I moved around a lot growing up. I was born in New York City, but I went to middle school and high school in Houston, Texas. And I started writing after a brief. Coach Greg mentioned Goldman Sachs, and this I think was a really good experience because I learned in about 6 months. This is definitely not what I want to do when I grow up, but I also learned how people in that industry think. And we're talking about the Warren Buffetts and the investors of this world. So I got a good background, but I started writing and I gradually went into more investigative stuff, organized crime, and fraud, waste, and abuse of various kinds. And I finally ended up with a well, I wrote a book about olive oil fraud, which was fun, but it's sort of again a microcosm of what's wrong with our healthcare, with our food system. Sorry, I say healthcare every sentence. I had to get it in there too. But with our food system, which is the same kind of stuff, people lowball, selling lowball stuff at very high market and pocketing the difference. Then I wrote a book about whistleblowers, and I realized as I was writing this book that really we shouldn't need a word for whistleblowers. Whistleblowers should be the norm, right? And it's a sign of how corrupt our societies become that we have to have this special kind of scientific name for people who stand up and say, "Excuse me, I think this is illegal. Should we stop?" And they get crushed, right? It's like they drop the Titanic on them and keep dropping it, just to make the point. So as I was writing this book, I was thinking, my God, this is a situation we need to change in America. We need to revert to or invert the norm. The norm should be do the right thing, think about a community, think about your fellow people, and not think about eating others alive and stepping on their necks, which is really kind of what produces whistleblowing. Because at the end of the day, when you have an extreme case, either a government agency or a corporation that's secretive and it's got this mission, or wartime, it's for example, people are going to go crazy. They're going to follow that mission to the detriment or destruction of their fellow human beings, and that's got to stop. So in the process of writing that whistleblower book, I talked to whistleblowers in dialysis, and it was going to be a chapter in my whistleblower book, and I said, no, this is its own thing. When I realized what this was, I realized, no, this is the healthcare in America, the situation of American healthcare. This is a snapshot of what's gone all wrong. These are paradigm patients. I mean, dialysis patients are the ultimate vulnerable patient. They need this 3 times minimum to survive. And they have the ultimate sort of Scrooge figures, these huge corporations, controlling their lives. It's more like incarceration in certain ways than it is healthcare. I mean, I hate to say that, but that's true. One of the very few lawyers who took an interest in this was a lawyer at the Innocence Project, Black Death Row, which he was very successful in, and getting rid of capital punishment. And he said, this really reminds me of my old work. And that was when the coin dropped. I said, oh my God, he's talking about incarceration. And we're talking about taking people and basically controlling their bodies to come to our facility. And you will sit down there and you will stay there until I tell you to get up, and you will, I don't know. It's something that's really awakened me to the need for change, the urgency for change. I took a lot of, a number of patients said, well, I don't know if I want to talk to you on the record because, bad things could happen to me in my clinic. And I said, you're absolutely right. Let's not do that if you're not comfortable with it. And they'd come back. Several of them came back and said, okay, I'm going to talk with you, but on one condition, that when I'm gone, you'll promise not to let this happen to anybody else. And it's not an easy promise to make, and I'm going to do my darndest to keep that promise. And that's kind of why I'm here and why I'm not going anywhere.
There was a number of years ago, and I think I can't remember his name. He had a clinic, renal clinic in Inglewood, right there across from the Forest Lawn. And I believe he would go out to barbershops. Do you remember his name, Kim?
Bill Relaford.
Yeah, Relaford. And he would go out to barbershops and have
Dr.
conversations.
Vaughn as well. Dr.
Yeah,
Vaughn.
and have those conversations. Now, I think I met him he was at the Dr. Rosie's Black Writers on Tour this past year, earlier in April. He now has started a farm. He's growing healthy vegetables and fruits, and he's catering to that marketplace that obviously in our food deserts in order to at least make sure from the self-care space that they're eating right, because that is an issue in our community. I know the former CD director of Recycling Black Dollars after Mohammed Nazardine. It was just a short, brief moment. He was there for about a year and a half, here for a year and a half. He died from renal failure. We have a member of RBD that is currently going through dialysis. And so, yeah, it healthcare in our industry, in our communities is critical from every level, from heart to whatever, because a lot of times, especially if they're seniors, when you go to the doctor, they just discount anything that that senior is saying. And so they really have to have an advocate with them, so that they can fight for them. Without that advocate, a person there to hear everything that they can't hear. And also you have to get on the phone and then you got to fight, right? So I know I had to do that with my mom with cancer, had to do it with my uncle when he had cancer. You have to have someone go with them because they're not going to ask questions. They're sick.
They're sick. They're not
they're
feeling
sick.
good.
And
Yeah.
then the doctor is discounting them anyway, not to even answer their question. So they come in. So there's no one that's putting up a fight to demand that. And so we need to do that. But Robert, I like the fact that you're talking about us being an advocate. There are, and I think I put in the chat, there are, a number of health organizations, nonprofits. Must have about 1,000 nonprofits in Los Angeles all by itself. And a good portion of those deal with our health issues. We should really be getting them on the show to talk about, and then using us to help get their word out. And the same thing for you, Tom, because it's very important. Because one of the things that for this next president that's coming in, it's not just him, it's that Project 2025 that's an issue. So anytime we start talking about things that pertain to Black people specific, or brown people specific, or Asian, especially with Black people, it becomes, okay, it's a woke agenda. And so we got to come up with a way to get around that using different verbiages, but it's going to be the same thing. And so that we can fight for our people. It's going to be the next 4 years. Hopefully it's just 4 years. It's going to be vital that we fight for our people. And in order to make sure that we get the attention, because that is not Project 25's agenda at all. It is not about minorities in the least bit. And so every time you say something about fighting for Black people and kidney disease, okay, you're being woke again. So we got to come up with a challenge and a way, a strategy, in a way that we can continue to fight for ourselves and find those allies that are out there that can help us do that. Sometimes it might, but even with our allies, they'll tell you woke too. So I don't know. And so I don't know what we do, but I do know the more voices, the squeakier that wheel is, the more attention you get. If that means media attention, finding those individuals that are open to doing documentaries and things of that nature, that's what we need to do. Yes, Kim?
You brought up Dr. Relaford, and now that I think about him, he was doing some very innovative things. His practice actually avoided amputations, just really innovative things, and they came for him.
Yeah,
they came for him. And put him out of business. And then there's another brother on Crenshaw, and I don't remember his name, but he worked with the heart, same thing. They came for him as well. So I would just say, get our houses in order. Get our houses in order when we start.
Yeah, no, absolutely. Have your footnotes real clear. Another thing you brought up that really makes a kidney disease is sort of almost again, it's a silent epidemic. There are people who talk, Hollywood stars who talk about cancer of various kinds. There are celebrities that are talking about various diseases, but no one stands up. I saw a billboard in St. Louis, LeBron James with a gentleman with an amputated arm, and it said, diabetic amputation is a national emergency. And I'm like, absolutely. And LeBron, when are you going to talk about dialysis? When are you going to talk about kidney failure? I think, it's risky to rely on celebrities, but some folks have to stand up here. And if we can find, I have to say that there are a couple that I'm working on, that I've been talking with, that get it. Because I say, hey, do you know anyone on dialysis? And they're like, yeah, I know 12 people on dialysis. And yeah, don't you think we should look into this a little bit? Here, let me read from my book, so I think, getting people to do that same level of, but you're right, they will come for you. This is big money, and you need to have your house in order for sure.
We're getting down to the wire, but Greg has a great question, and then Shamika had another follow-up. She has also, but Greg says, is the dialysis industry organized crime?
Well, they're organized and they have done crimes. So I don't think I answered your question, but sort of did, right?
Yeah.
No, I mean,
Yeah.
what is organized crime? I mean, it's when I wrote about olive oil fraud, there were these gangsters down in the south of Italy who did this sort of the tankers in the night of weird substances from Turkey. But then there was the Nestle's and the Unilevers and the others who bought from them, knowing full well that they're paying pennies on the dollar, and it can't be what it actually says on the contract. And then when then the bent nose guys down in get caught, the multinational like, oh my goodness, oh no, my contract says I am going to sue them. They knew very well what was going on. They were extremely organized, and they were networked with these folks. So I think you can get my answer from that.
Hey, Tom, and then one final thing. You mentioned a kidney failure drug medication.
Right.
Can you repeat that?
Absolutely. There are a bunch of them. There's Ozempic, Wegovy, Jardiance, and a bunch of others.
They're running 12 million commercials a day.
And they're selling to rich folks who want to look good for Thanksgiving dinner, right? I mean, they're not selling to the people who really need them for. But apart from losing weight, which is a great thing, they have, and I get this not from my own knowledge, but from absolutely cutting edge scientists, they have almost miraculous healthcare properties for kidney care, but also management of diabetes and other precursors to kidney disease. These things need to be priced so that everyone in the hardest hit communities can be using these things. And then guess what? We all save billions of dollars, right? By making this, because prevention, an ounce of prevention is a pound of cure. Prevention will prevent this $100 billion a year price tag that we currently spend on dialysis. Just make that go away. $100 billion, that's real spending money where I come from. Yeah. And prevention is going to keep people out in the workforce, because if you're on dialysis, you're not going to be working very much. It's hard. You're going to be therefore paying taxes. You're going to be, not only are you healthier and happier, you're also more productive. So it's a way to save a lot of money by investing in those drugs to get them out there as quick as possible.
The Ozempic is not covered by Medicare, but Wegovy is. But I think you just, again, it's about the patient or the patient's advocate being able to advocate for them to get it pushed through, so that the doctor words the prescription in a way that it's for what it's supposed to for. But if it's for weight loss, or if they think that and they perceive that to be the case, then that's going to be the issue. Tom, you've been...
Sorry to interrupt, but I believe that President Biden has said that certain of these drugs, the SGLT2 and GLP-1 drugs, are going to be covered by Medicare.
Yeah, I think the Wegovy is, they're still working on the others. And then there's certain areas like Kaiser doesn't, up in the Bay Area, Kaiser actually pays for it, covers it, but not here in Southern California at the moment. So, but thank you so much, Tom. Please come back. However we can be of assistance. The contact I told you about this morning, I will, once I send her the show, I'll have her and Robin reach out to you, because if they're going to put together an IPA Black IPA network, then that might be something that you truly want to jump in on. And then there's some other organizations. I know Black Women's Wellness. They work in these areas. So maybe we can connect you with some of our nonprofits that are in these spaces that we have contacts with, and introduce you to them so that you can actually work through them as well. And they could use the help as well.
And Tom
ma'am.
corrected
Most
his
grateful.
email address is tom@tommueller.com. I left the M off.
It's
Okay.
actually .co, not
Not
.co. Okay.
There's
Okay.
there's another Tom Mueller out there who
Oh
gets
yeah,
a
I
lot
saw
of
that.
email.
He's
He's a nice guy, but I don't want to
scientist.
press his patience too much.
All right, Stephen, you want to tell us who our guests will be for next week and the following week, actually, too?
Next Thursday, we're going to have Carisha Moore, who's the president and CEO of Complete Succeed Education Resource. Also, she's former executive director for Ushers nonprofit. She served there as president for 14 years, and she's going to give the inside scoop of what's going on in Hollywood in the music R&B world, as well as how we can equip our children to succeed.
Awesome, awesome. And the week after that, we have Audra Bryant coming on. She was on the Business Zone 2 weeks ago. Amazing young lady. She had suffered severe burns at 18-month old over her body, scars all over her body, and she's written several books. And just such an amazing outlook considering what she has gone through. So she's embraced that, and so she's helping other burn victims be able to embrace their bodies. Beautiful young lady, very talented, and so she learned how to take her uncomfortableness with her own body, and then develop and discover her other talents. And she is now going out sharing that. So definitely come back in next week and the week after, and then we're going to wish you all a Merry Christmas. And then we got to get prepared for 2025 because it's going to be a
Year of advocacy.
rough 4 years.
Crystal, I suggested you and Gil invite Tom to be on the Business Zone. He is a lot of fun.
We'd love to have you. We'd love to have you.
He's bi-coastal. He lives between LA and Italy.
Oh,
So
okay.
that's why I want to hear some more stories about that olive oil.
Okay.
Oh yeah. Oh yeah.
And on the Business Zone, we got
There's some stories.
We have a whole 2 hours. We can fill up your whole. It'll be the whole.
All right. How many stories you want? Yeah.
Yeah. So I'll send you a link for that, and we'll be planning for next year. But thank you so much for bringing this. Anytime you need us to talk to our community, then please, we're here. You're now part of the community briefing family.
Yeah.
I really feel grateful and honored to be a part of it, and I'm looking forward to doing good work with you guys. It's fantastic to meet you, and thank you for the invitation.
Thank you. Cheryl, I hope you come back. Tell some friends that this is the place to be at 11 o'clock on Thursday morning every week, unless we're celebrating a holiday on that day. And we look forward to Emma. We'll see you at the townhouse next week. And Sarah, I think she jumped off. So also, guys, check
And Kim will be there on the 11th. Kim, you coming?
It's my birthday is on Tuesday. I'm way out of town.
Kim, are you coming to? I know this is Sunday and that's church, and you're way out where you are. But RBD is
On
doing.
Sunday.
Yeah, we're doing a launch of the resource guide this Sunday at Culture Interiors.
What time?
At between 2 and 5. You can just roll through. Jackie will be there. So the flyer's in the chat room, in the chat over here, but I'll send it to you.
Okay.
All righty, guys. We will see you. Check out the flyers Friday with Michael Anderson, which is tomorrow, 11 o'clock at Chase Bank. That's where we are, right?
10 o'clock. 10
10 o'clock at Chase Bank.
It's on Zoom. It's on Zoom, Crystal, because the room only holds so many people.
Okay, so it's virtual and it's a hybrid, and so check us out on Zoom. So go over to Crenshaw Chamber of Commerce, and you can get the link and sign up there, and you can check it out in the comfort of your home. All righty, guys, have a fantastic week. Hope to see you at the upcoming events that are taking place until we see you again on Thursday. Tom, thank you so much, and please feel free to come anytime to share.
I'll take you up on that. Thank you very much, Crystal.
All
Thanks.
right,
Everybody.
Bye-bye, everyone.
Bye-bye.
I'm going to stop the recording.